Good afternoon, dear colleagues. Thank you, Professor Yang, to invite me to join this Europe and China Health Summit meeting. I'd like to share our experience in robot-assisted spine surgery. The chasing for robot in China can be traced back to 3,000 years ago. The book of 列子汤问 introduced a robot dancer, which was believed as the first robot in the world. It's a human-like form. In the post-Han Dynasty, a great strategist, Zhuge Liang, invented a mechanical cattle to transport food. In 1883, world's first such robot appeared. In the next 10 years, several different type and usage robot was invented. In 1998, Da Vinci surgical system were coming to the market. Until now, it's still the most successful surgical robot. It has completed nearly 1 million operations until now. In the last decades, many orthopedic robots have been applied in the clinic, most used for single usage, such as joint replacement and spine surgery, especially in the lumbar surgery. Spine surgery was developing by innovation of internal fixation, especially the pedicle screw since 1958. But the positioning error of fixation makes spine surgery the second major in medical disputes. Risk of spine operation is high. Mean complication of spine surgery is 84%. Accuracy of pedicle screw by hand is only 68%. Minimal invasive operation is popular nowadays, but it increases the appropriate risk of screw. If pedicle screw is not in the right position, it may lead to loosening, injury the nerves, even lead to death because of large vessels injury. So we need robot to get the screw insertion, but it must be clinical oriented. That means it must be friendly to doctors. It should three-dimensional image navigation guide. It better be multiple indications based on a modularity universal type, because your boss do not want to a lot of different type of robots to different area of orthopedics, and it must be focused on 3D positioning guide. In nearly 20 years, Titan Hospital cooperate with the Tiananwei company. We have designed 3 generations of robot. In 2016, the 3rd generation of robot approved by CFDA. That means it can be sold in China. It's the first robot which designed by China and used in China. It has 6 soft robot arms and is a real-time navigation. The system accuracy is less 1 millimeters, and it can be used in spine, such as internal fixation and navigation. It can be used trauma. It can fix the pelvic fracture, acetabulum fracture, limb and foot. It also can be used to bone tumor and sports medicine, and other fields. Compared Tianji robot with other robots in the market, it shows more accurate and there's multiple indications and can use two different areas of orthopedics. And the group is led by the surgeons. That means it's more friendly to the surgeons. And this is a Tianji robot. It can turn to every directions, so it's very flexible. Sometimes I feel it's like some small naughty dog. It's very interesting, right? Video shows typical robot assisted spam operations. First, we acquire 3D data, and then we design the pedicle screw, and after that, the robot will get the position of the pedicle, and with the guide, we can get through small incision and reach the bone, and use the K-wire to insert the pedicle screw. Through the K-wire, we can put the pedicle screw in the pedicle. After that, we can do the decompression and connect the pedicle and complete the operation. From 2015 to this year, we have done 1,443 robot operations with the patient's ages from 12 to 84. You can see last year we have completed over 700 robot-assisted cases in spine. These operations, including upper cervical spine, cervical degeneration, thoracolumbar, and spine deformity. We also publish quite a few papers using this system. We have done prospective randomized controlled trial. We compare the safety and accuracy of Tianji robot group with conventional fluoroscopy group. We use the Gerspin and Robins classification to evaluate the accuracy of the pedicle screw and approximate facet joint violation during of the surgery, intraoperative blood loss, and post-operative hospital stay were also assessed. (203) 400 patients was enrolled in these studies, and over 1,000 screws was implanted. The proportion of A-type, that means good, screw was significantly higher in robot group compared with fluoroscopy group. Two screws misplacement in fluoroscopy group required revision, but no one in robot group. 12 screws in fluoroscopy group violated the proximal facet joint, while no one in robot group. blood loss was lower in robot group than in fluoroscopy group. The surgical time is not significantly different between two groups. We also do a prospective randomized control studies in the cervical screw insertion. We also divided the two groups. Each group include over 60 patients. Table 1 shows the demographic characteristics of the patient. There is no difference between two groups. Table 2 shows the different detail screw types, and the screw include lateral mass, odontoid screw, maggot screw, pedicle screw, and there is no difference between two groups. Compare the result, you can see the robot group has less screw deviation, and the Crispin-Robbins scale is much better than the fluoroscopy group. There is no difference of duration of the surgery between two groups, but the blood loss and the length of the stay for the robot group is better than the fluoroscopy group. And for detailed outcomes, you can see that percutaneous robot group shows much better result. I like to show some cases of robot-assisted cases. This is the first cases robot-assisted spine surgery, which we have done in 2015. It's a 20 years old female, and is lumbar vertebral fracture. We complete these operations in 106 minutes, and the blood loss is 50 millimeters. It's a minimal invasive procedures. The post-operative CT scan shows that the pedicle screw is very accurate, all in the pedicles. The case 2 is the upper spine, cervical spine cases. This is also the first cases robot-assisted CMT2 transarticular screw fixation in the world. It's a male 43, is a basilar invagination, and has severe upper cervical deformity. The left X-ray shows the normal C1T2 articular looks like, but for this patient, you can see that C1T2 is a complex deformity, and it also has spinal cord compression. This is an actual CT. The preoperative planning shows that only one possible trajectory for screw is even impossible in the contralateral side. This is a very narrow passageway. It's just 4.5 millimeters, but the screw is 4 millimeters diameters. So if for freehand insertion, it will be very difficult. So we need the robot to get the screw insertion. And this is an operation procedure video in the operation. This is the put the screw in. This post-operative CT shows that the screw is only 0.0 millimeters deviation. This is a female 12 years old and is a AIS patient, and his back deformity has been found for 1 year, and the deformity progressing obviously. This is parameters in coronal plane of this scoliosis patients. The diagnosis is adolescent scoliosis. The type is Lanky 3CN. Usually for scoliosis patient, the vertebral really has rotation. That means the pedicle screw fixation is usually very difficult. So we need the robot to get the insertion of the pedicle screws. And for these patients, it's very successful. Every screw in the right position. This is the result. We can see the pedicle screw is accurate and the patient gets a good correction. This picture compares the pre-operative and the post-operative the patient's back. It shows that the patient get good correction. The case 4 is C324 instability is AS patient. It needs cervical screw fixation. This is some design the position of the pedicle screw. We use the robot to get this percutaneous procedure. This is a post-operation CT scan. You can see the pedicle screw is very accurate. This is a very typical case, and it's a male 26. It's a lumbar spondylosis, and you can see the breakage of the parts, and we want to fusion this area. But the passageway is very narrow. We do a precise surgical planning and use the robot to do an accurate operation. After the operation, the CT scan is look like that. You can see the screw is in the right position. In our hospital, we have performed more than 3,000 orthopedic surgery assisted by robot. The indications include all spine level and also include pelvis, acetabular fracture, long bone fracture, foot and hand. Robots start the revolution in the field of orthopedics. Tianji robot is a multifunctional robot. It shows accuracy and safety in different kinds of orthopedic operations. It improves quality of routine surgeries, simplifies the complex surgery, facilitates the minimal invasive surgeries. In the future, new sensors and AI will make the robot more like persons, improve the effectiveness of the robot. Thank you for attention.